Good evening. We are going to begin here tonight with a story from the world of medicine that could end up affecting just about every American. This is a story about cancer, its treatment and prevention, and this time it's a story about aspirin. It is without question the cheapest medication in the American household. Its role in preventing heart disease and strokes is well documented. We call it the wonder drug. But this is about something else. It's new evidence tonight having to do with the role aspirin plays in cancer, specifically helping to prevent and treat several different kinds of cancers. And we want to start off tonight with our chief medical editor, Dr. Nancy Snyderman.
Like so many Americans, Dana Garmany started taking an aspirin a day 10 years ago to help prevent heart disease. After being diagnosed and treated for colon cancer, his doctor told him to stay on it.
My doctors in Houston told me that aspirin therapy was now something that they thought about as a help against recurrence of cancer. So I've been taking it ever since and continue to do it for both reasons, the cancer and the heart.
According to a review of studies in the medical journal Lancet, aspirin may have a new role in cancer prevention and treatment. Consider the statistics. People who take aspirin have a 15% lower risk of dying from cancer, a 38% less chance of developing colorectal cancer, and aspirin may also reduce the risk for cancers of the esophagus, stomach, breast, and lung. Taking aspirin regularly may also provide benefits even after diagnosis. Aspirin users have a 36% less chance of having cancer spread.
There's reason for hope that aspirin may have this additional benefit in terms of preventing cancer, but at the same time we also know that it's not a panacea.
Doctors caution that aspirin still carries risks. It can cause stomach upset and bleeding. But these new findings suggest the benefits of cancer prevention may outweigh those risks. And that has some doctors hopeful.
My patients will often ask me, is there something I could do to make my cancer treatment better or more optimal? And the answer has been oftentimes no. Then something like this comes along and we forget about little old aspirin, and it can be incredibly helpful.
Doctors still insist that you should watch what you eat, exercise, and obviously avoid smoking. But this little pill, an aspirin that just costs pennies a day, this is one of those things you might just add to that list, Brian.
Because it's ubiquitous.